Hi, hi everyone. I'm happy to discuss to you about a presentation. It is based on exploring varieties of contemporary issues within the nursing area of the health and social care. Nursing is the area or practice in the health and social care sector that focuses on the promotion, protection, and optimization of human health through guiding and helping individuals in preventing injury and diseases directly. This is different contemporary issues within nursing practice in the health and social care sector that could influence service. One is workplace inequality. The workplace inequality from the staff, patients, and individual, since nurses are the health responsible for checking and monitoring the health condition of the patients, and they spend most of their time assessing, monitoring, helping and improving the health of the patients. However, they are not treated equally like other healthcare professionals, such as doctors, physicians, surgeons. It has indicated inequality in the nursing service. Another one is the heavy workload. Several studies have declared that nurses in hospitals have to work for 12 to 18 hours on average. The workload is extremely high for nurses in the healthcare sector. Nurses have to accomplish a lot of activities to assist patients in overcoming health diseases or illnesses. It has adversely impacted the service delivery of the nurses, which impacts care service. The issue influences service improvement in the nursing practice. Another thing is the health and safety risks and hazards. Nurses in healthcare settings have to manage medical devices, medications, diagnostic tests, assessments, and chemicals in order to diagnose, assess, treat, and prevent diseases. So there are high risks associated with the roles and responsibilities of nurses. They have frequently faced health risks and injuries while handling medical devices, diagnostic tools, medications, and chemicals. This issue in nursing service also includes service improvement. Another thing is the different contemporary issue within nursing practice in the health and social care sector that could influence service improvement. It is all about those staff retention issues, which is most commonly identified issues where low morale through lack of recognition of their skills and work, low pay scales, large workloads and stress from staff shortages, and cost cutting, lack of development and career opportunity, flexible shift work. shortage of skilled nurses. Why are these skilled nurses, why are they leaving their workplace? As been said, due to those low pay scales. I've known one, not only one, most nurses left the UK. I know few of them. But they really wanted to stay and work in the UK. But the reason is their pay is low while their workload, you have a heavy workload. So they move to other countries like America and in Australia. This is really so sad. They're coming from the UK. They've been working as a nurses in the UK. But why? They love the UK. UK is also a good country to work with. But the reason is about low pay. They always say that pay is like a peanut. Why you work hard in the UK while the pay is like a payment for the peanuts. I'm so sorry about this, but this is what is happening this time. Next is the challenges and meeting patients' satisfactions. Nurses or patients are not getting the good care from the nurses, because nurses is always tired. They are not given more. Some of them are not given priorities. They're in there waiting for until how many hours been waiting for this for the queue to be treated, to be seen by the nurses. The next is analysis of the key perspective and the impact of the issues on care delivery. Impact on patient demand and satisfaction. That's it. As I've been said, that patients are not getting the right care from the nurses, because nurses has always been having a heavy workload, shortage of nurses. Another examples that I will share to you is I work in one of the nursing home. I only have one patient to look after. Every time when I get in there, one of the nurse in there, always been stopping me to help her, to get dressed one of the 2 or 3 of the elderly. She wanted me to help to get dressed one of the elderly, and after another one is there was another guy, elderly, to having need a bath, and the nurse is already, it's her time to go home. She always been saying please to me, please can you help me shower this. Really, this is not my job, because I'm only going, I will just go there just to look, just to check my my elderly patient. But here comes this nurse, always asking for help. Poor nurses. She's working. She always go home late, working too much hours. What is what the said workload that she was given supposedly. Always go home. Should be go home before or 8 in the morning, but she's go home 12. Another one is delay in the treatment. Because of this shortage of his nurses, treatment is always been delayed. For the patients who is waiting for their care, but we cannot we can't help. The nurses always say we can't help because there are other patients who is still waiting. So what else we can do? Just need to wait. This is not right sometimes, but we need treatment, so you need to wait. As a patient, you need to wait to be treated instead of going back home because you just keep waiting in there for the nurses to come and assist you, to help you. I also have an experience about this. An example wherein I was a student nurse. We were in the hospital. I am assisting the doctor. I'm assisting the doctor. And while I was looking at the nurses, my eyes is busy looking sometimes of the nurses whom I handle those babies. I'm helping the doctor for the deliveries of those babies, of the mothers, in the delivery room. I was in there helping the doctor. After the babies come out, she will be or the doctor is handling the baby to the nurses station. Well, the nurses was been busy in there. They were being confused. They did not put the name tag of the baby. So the baby was being mixed up. They don't know. But when they were discussing, arguing together, two nurses were arguing together because another baby came out. But the first baby was not the name tag was not been put in her hand. It was not given a name. So another baby been handed to them. So they don't know which one is which name of those babies is. So I don't know what happened to the babies at the time because they were still been arguing. They don't know which one. They were being confused. They don't know the name of those two babies. Which baby's is name of the that they had. So it's because of the busy, because of their tiredness, because of the heavy load of nurses, they become confused, tired, and this has happened. They are having negligence of their job. Called it as medical negligence. But sometimes, even it's their fault. They still been trying to the boss in the hospital, or the boss in this their boss trying to cover what they have done. It's a poor for these patients. The next things that I'm going to discuss to you is it should be the nurses should go for the training as well, because whatever they learn, they need more updated. They need to be updated to have an efficient for the job, to help for the patients, for the help for this to have a good output for the job. needed training. Training is an important as well for those nurses. I had been in the hospital for having us have a surgery twice. Nurses always coming to take a blood from my hand, blood from me. They're taking the blood infusion, but they cannot see they can't see in the veins. They keep inserting a lot of needles, so hands come swollen, a lot of sore that I had it in my hands. It's all pain, but it's nothing for them. They always say so sorry for what has happened. It should be a negligence for them, because they should go for a training. But what else I can do? I just say it's okay. I accepted this sorry, okay. And I'm so sorry for for myself, for my body, because I got loads of pain inserted by all those kinds of how many needles that was inserted. If they have the professional with their job, they should knew what is good, perfect for them to do. They knew their job. They should be efficient. They do it perfectly. But because of this workload that they have, sometimes they are confused about of this shortage of nurses. They cannot do all the job. Anyway, thank you for listening with my with all this presentation that I had. I'll now have to say something about the workplace. We are not, we always say that we are not perfect in our job, in what we do, but we need to be careful. We need to know what is really the responsibility that we have as nurses. Having to commit medical negligence to is not really it's not, you are losing your job, your profession. For the last thing that I'm going to share is about the workplace inequality and violence, heavy workload, health and safety risks and hazards, is staff retention, issue shortage of skilled nurses, challenges to meeting patient satisfaction are some of the contemporary issues in the nursing practice of the health and social care sector. Due to the issues in nursing practice, it has impacted on the patient's satisfaction and care delivery. This is all. I'm Felicidad Campat. I'm a student of this contemporary issue. Thank you. God bless you.